Hello and welcome to GradCast, the official radio show and podcast of the Society of Graduate Students at Western University. I'm your host, Liam Clifford.
And I'm your co-host, Francesco Colosimo.
And today we're here with Professor Samuel Wong. Thank you so much for being here, Professor Wong. It's a great pleasure.
My pleasure too.
So, Professor Wong, we understand that you did a keynote speech here at the university in regards to COVID and how it's affecting people and their mental health. Do you just want to go into a bit of detail as to what your keynote presentation entailed?
It entails some of the studies that recently have been conducted around the world on the increase in the prevalence of mental health related issues during the COVID-19. So that includes some of the increases in the prevalence of depressive and anxiety symptoms, insomnia, and some of the psychosocial issues related to COVID-19, including the problems of loneliness, inaccessibility of some of the health services for older adults, and also how COVID-19 might have differentially impact those who might be socially disadvantaged.
So that's really interesting, Dr. Wong. You mentioned that, there may be certain groups that are disproportionately affected, in regards to their mental health and COVID-19. Would you like to explain this further?
Yes, for a lot of these research evidence point to those, for example, who might be more socially vulnerable. For example, the people in low-paying jobs, they might have difficulty to protect themselves from the infection as they are often being unable to work from home. And they might have problems of accessing protective equipment to protect themselves and their families. Another group are the older adults who might not have the usual physical support during the pandemic, which might make them suffer from increased susceptibility to mental health related issues resulting from lack of support and maybe loneliness during this time.
No, it's clear that COVID-19 has affected us in a multitude of ways, mental health being one component. Have you found that individuals with prior mental health conditions have had their conditions exacerbated by the onset of the virus?
What I'm more worried about is those people who might have improved before or who may be in remission, that they might be experiencing a relapse due to the lack of support, due to the exposure of the media emphasizing on the risk of being infected, some of the misinformation in the media, and especially affecting those who might have lower health literacy, for example. Some research has shown that people with low health literacy are more susceptible for some of the mental health issues, and also they might be more at risk for being infected due to the misinformation that they take, and also that they might take the information from these channels.
Yeah, that's becoming a major issue in today's society, especially with the prominence of, social media and all these things, where especially in regards to important information and, COVID-19 information, it's becoming really hard to tell, which information is true and which isn't. So what do you think, some of the strategies are to kind of combat this misinformation and just ensuring that, everyone's having the most correct information?
I think it's a difficult issue to deal with because we often, I think somehow, I think the world may be sometimes very divided on a lot of things, and social inequality is becoming emergent issues due to a lot of the differences in terms of a health system and also the distribution of resources. But although I think there's a difference across different countries depending on the social system that the country has, But I think one of the ways to actually understand these people more first, such that you can gain the trust, because I believe um, different sector of the population may trust different sources of information. So before we can say we can intervene, we really need to do more research to understand these people, their backgrounds, who they trust, and actually to convey the correct information to those people that they trust and help them to actually, in a way, to empower these people to spread the right messages. So I guess a lot of the research and information may be from more the top, right, from the government. But when you try to implement and try to influence people behaviors, you really need a bottom-up approach to see where they're coming from. For example, in our survey that was conducted within 72 hours of the first case in Hong Kong, we realized that at that time a lot of people don't trust the government. Actually, they trust the doctors the most. However, it's very hard to get access to the doctors because of the some of the clinics were very busy dealing with COVID-19, or they are in preparedness, or some of the clinics were closed. So it really takes much effort for the government to have daily briefing, daily communications with reporters, and transparency increase to gain the trust from the public.
And I think raising the point of government is a very important point because it's been widely documented that the relationship between Beijing and Hong Kong is tense, to say the least. How has that relationship affected Hong Kong's ability to combat the virus?
I think because of the year prior to this, there was a social unrest in Hong Kong
Mhm.
that developed sort of a divide in the society, and a lot of people might not trust the government, and that's what the distrust was coming from. We also did the study in the UK with Imperial College London, and we found that over there people do trust the government more, and they actually receive the information from the government more often. So in Hong Kong, we found that people trust the social media more. So they would trust the Facebook, the IG, and all these different medias that is available in Hong Kong. So, but because of the government doing the daily briefing and the person who represent to speak very warm and genuine um, public health doctor who are very willing to take question and shows the patients with no um, with a lot of patience and really let people ask the questions. And so I think slowly over time, people are gaining the trust. Although I can still say that there's still a lot of distrust, but I think there's a bit of an improvement. At least people will still, I mean, if you look at the Facebook, whatever the media, the news, they will usually have a good comments about this doctor who has been working daily since January. We're still seeing her every day at 4 p.m. So it become a sort of an icon for someone who is very objective, who is non-biased, who is willing to listen, and also willing to admit mistakes. Actually, sometimes she said that I made a mistake and blah blah blah. So she's very transparent, and people gain the trust from that. I think we need some genuineness in our communication and also be factual and show people that you also have limited information sometimes. So you don't know anything. I'm not sorry, you don't know everything. So sometimes there's uncertainty, and she admitted that from time to time.
I think it's, one of the really interesting things you said there was that often, some of this information communication, it could differ between countries or cultures based on, their trust with the government or how they trust certain media platforms. I guess going on that, I was wondering if there were any major cultural differences or differences across countries in the mental health of these countries, during this pandemic.
I haven't come across a clear differences in terms of the prevalence. It seems everywhere there's an increase in prevalence of mental health issues. Study have done from China, from Japan, from Israel, from Italy, Canada, and you can see all these results. The differences is sometimes on how the health system deal with the problems. And there are maybe differences between countries. For example, here in Hong Kong, most of the clinics are still open. And we don't have a very strong tele consultation system. So people still go to the clinics, because people are used to wearing masks, they are very aware of the fact that they wear masks and perform the the infection control measures, etc. So they don't have a lot of objection to that. While I think different countries may have different ways of that. And I think there's differences in suicide rate, for example, in different countries. And that I think with the pandemic, that might exacerbate a pre-existing differences in terms of the prevalence of diseases.
And I think that's a really interesting point, how certain populations are already accustomed to wearing a mask just because it had been a part of that culture, prior to the onset of the virus. Now, specifically to Hong Kong, how has it been able to really fight the virus? Because from what I understand, Hong Kong has incredibly high population density, which I mean, in theory, is breeding grounds for a virus. But how is the SAR been able to really combat the virus?
I think one of the, or I would say the advantage, but one of the things that we have learned from our experience, so we have the SARS in 2003, and that sort of immunized the people about new emergent infectious diseases. So even before January, people are very aware of the impacts of this emergent infectious disease, and people are very worried, and that's why they are very ready to take precaution against the disease. And even before the current pandemic, all the doctors and healthcare providers, they wear masks in hospital and clinics. Even family doctors wear the mask to see the patients for the last 15 years since SARS. So when the first case occurred in Hong Kong, more than 95% of people were wearing masks already. So that's why I think part of the reason is that people are very willing to take the infection control measures, simply because they are more used to it, they're more accepting it, and I think people do it before the evidence on the wearing masks come out. So which is quite different from other parts of the world, and I think that might account for that. And now we are having, I think today we have about 70 something cases just today, and people are already very worried, and they are thinking about more restriction, etc. So people are very alert, and I think that's the general. And because of the density, people tend to learn from each other also. So there's a good side for that, because you can, social modeling. One of the health behavior changes that you have some social, according to some of the theories, right? So when you go to the street, you see all these people wearing masks. It's very hard not to wear them. So it's sort of, and because it's so densely populated, people would just look at you if you don't wear them, because they know there's increased risk. So I guess it's a double-edged sword. It goes both ways. So it is more at risk, but people are more aware, and they can more likely to see a model, another person's wearing mask. So I guess that might account for the reasons.
I think it's really interesting that you said that, a lot of people may feel kind of pressured to take some precautionary, measures like social distance or wear a mask just because they see other people doing that. I wish there was more of that over here, in Canada and North America. And I guess just switching over, we study a lot of graduate students' research here on this show. And we're hearing that a lot of people's research is being affected by the COVID-19 pandemic and, getting participants and so forth and so on. And, your research is on COVID-19. Were you kind of experiencing some difficulties researching COVID-19, due to COVID-19?
For COVID-19, I think because initially we did a sort of an online survey, so that was not affected because the ethics approval was sought. Because we were expecting something like that even in November and December, so it's an ongoing thing. What I found difficult to have problems is the non-COVID-19 research. I have several randomized controlled trials that need to recruit older adults in the community, and they all stopped because of COVID-19. It's either that there's a restriction on gathering, or that people don't want to come, or that it's just, or it's harder to find even the instructor or people who do the intervention to come and work for you during this time. So there's a huge delay for that, and I'm more worried about those because COVID-19 sometimes get the priority now, so people tends to put more resources in that. So the ongoing research, which is also important, like chronic disease, older adults' health, environmental health, sometimes get less attention, and that to me is also a problem because those things are not less important than COVID-19. In addition to COVID-19, we should still invest in the other research areas. And because they are affecting each other as well. What is COVID-19? Oh, COVID-19 is everywhere now. So all the topics that we did before are still being affected, and they might, and the problem that we studied before might be worsened during the COVID-19. So I think that's the difficulty I found, and the funders have sometimes do not have enough compassion for us, and they still ask for your interim report and the updates on recruitment. So I think it's difficult because it's long. It's 1 year. It's almost 1 year now, and they only have the budget. So how long can you extend a thing for? And you still need to recruit people, and the funding agency or the donations may be getting less because of the economy. So there are other impacts that are interacting and affecting each other.
And I think you mentioned an important point in the allocation of resources and how important it is to make sure that certain things are prioritized over others. Now, has this sort of contributed to greater, I guess, calls for mental health supports for people in Hong Kong? Obviously, mental health has been something that has come up over the last couple of years and is slowly becoming a largely developing field. Has the virus really contributed to people's, I guess, understanding of how important it is to ensure that your mental health is in good standing?
I think I'm not sure is it because of the culture or whatever, mental health have not received the attention that I think is needed. And it has always been like, or it's not always, but have been a long time like that. I cannot say always. I don't know what many years ago. But and during the COVID-19, I still think the physical measures, the infectious diseases, they still tends to attract more attention than the consequences of COVID-19. So I think this continue to be a problem that people tends not to think of mental health as an essential component of health compared to the other aspects of healthcare or health. So unless you see an increase or dramatic increase in mortality, which takes time to see, I think people still haven't paid enough attention to mental health and mental well-being. And there's a tendency for people to look into diseases which is more easier to measure, easier to quantify, and things like quality of life, those sort of things. And people tend to think it of a secondary importance compared to other statistics that we see.
Yeah, I think the idea that mental health is as important as it is kind of gaining traction everywhere, and we would like to see increased measures and interventions
Yeah.
placed globally to increase everyone's mental health, not just because of COVID but just in general. Have you seen any promising interventions or strategies or ways that are kind of coming up right now that have been successful in kind of aiding people in improving their mental health?
I've done a brief literature search, and you couldn't find a very good evidence-based intervention so far. So it seems everyone is focusing on the epidemiology and how to control the infectious disease, doing modeling, etc. But there's much lack information and evidence-based intervention for mental health. There is some intervention from mainland China which talk about tele consultation, and some of the emergency support and crisis support for mental health. But I don't think they are of um, really like it's not those bigger studies that like a good trial to see. So these are more like a pre and post intervention and just an evaluation. And I think some of the countries are just very busy dealing with the mortality and the mobility with the COVID-19 that they haven't have the time and resources yet to, seems not on the priority yet for devoting to evaluate the mental health interventions yet.
And it almost provides a research gap for further analysis of how a virus is not just a superficially mortal instance. It's really a multi-layered I guess obstacle for society with the implications of mental health. Now, it's apparent that amongst a lot of young people, as we are all of a younger demographic, can tend to suffer from mental health quite stringently. And I I think through your research, you provide an important note to those individuals. Is there any recommendations you would have for these people undergoing mental health issues at the moment, and what they can do to sort of help, I guess, give themselves the best chance to succeed?
Yeah, I think first of all, they, even though they might not be able to go out sometimes, they can keep the physical activities. I think exercise, even at home, moving a bit will help them. The second, they can try mindfulness or some brief meditation, breathing exercise to do that. And third, they can observe and knowing when it's enough for the information. They should have some break time from the news, from the information. They shouldn't be. I think the iPhone is so attractive these days. They have all these nice pop up to seduce you, so that people that addicted to that. So we really need a break to be away from that and put them away, not in our visual field, such that we will not be lured into seeing it every 5 minutes or 10 minutes. So I think having a break, meditation, um, and some exercise that could definitely help them to at least get some distraction from the news, from the COVID-19.
Yeah, I think those are all really great strategies to just try to break up the monotony and try to switch away from all the COVID-19 or all some of the negative news that's happening right now. Um, and I guess we spoke about some groups that could be potentially vulnerable to some mental health issues. And one of the groups that I thought of was students, considering we're all students, and historically we have seen some, mental health issues in the student population, specifically in university and so on. Have you heard anything about this, about, the mental health of students during COVID-19?
Some of my colleagues have done some survey, but they're still getting results back. It seems the students are also affected quite a lot. And I would not be surprised to see an increase in prevalence of anxiety and depression. And because of COVID-19, I found that over the last decade, or almost 15 or 16 years, I found there's an increasing prevalence of mental health related issues among students. And it seems that the stress, the daily stress, and the use of the often the technology and etc. might have exacerbated some of that. So I think it is an important issue to look into.
Yeah, it's it's that constant exposure to all of this unfortunately negative news that I feel so often undermines people's well-being, just for lack of a better term. Now, Dr. Wong, is there any hope? Can we hope towards the future for everyone's mental well-being? Like, is this something that we can truly achieve together as a sort of global society?
Well, I think there's always hope. The fact that all of you are interested in this topic shows there's hope, right? So, and we're all willing to address this and to raise this up, and to, well, in a way, it's fighting for the proper attention to this problem. Shows that there's hope. So, and I think the good thing about the internet, etc., is it makes it much easier to connect, right? So that things like what we're doing now is could be a good way to gather more people and the momentum to study more and to evaluate more important solutions to this problem. I think the more people are involved, the better solutions we can think of.
Absolutely. I think you bring up a really good point in how, even though we're all remote and even though we're all at home, reaching out to others and some friends could really, just help one person's mental health, but also create a larger change and some sort of, ripple effect. And it appears that, we're coming towards the end of our session. Dr. Wong, would you like to have any last sentiments for us before we end off our great session with you?
Yeah, I think we should always be hopeful, and I think seeing the bunch of, I think the students, etc., that are interested in the topic and the response shows that we should be hopeful. So I think what we need to do is to have the confidence of believing what we're doing is important, and to change, to be a change agent ourselves for this problem.
Very good. Well, you heard it here first, folks, that we are hopeful for humanity's future. Dr. Wong, is there any sort of website or social media you'd like to share with our audience?
Yeah, if you're interested in the work that we're doing in our school, our website is sphpc.cuhk.edu.hk, the School of Public Health and Primary Care at Chinese University of Hong Kong.
Thank you very much. This has been GradCast, the official radio show and podcast of the Society of Graduate Students at Western University. I've been your host, Liam Clifford, and my co-host was Francesco Colosimo. We've been speaking with Professor Samuel Wong, and this episode was produced by Ariel Frame. If you would like to be involved with the show or get in contact with us, email us at gradcastradio@gmail.com. You can follow us on Instagram, Facebook, or Twitter at GradCastRadio. To listen to us, we are on Radio Western 94.9 FM. You can also find all of our episodes on our website at gradcast.ca or on podcast apps like Podbean, iTunes, and Spotify. Alternatively, select podcasts have been uploaded to YouTube at GradCast Radio. Thank you for listening and have a good day.